The BioLife electrotherapy machine provides a number of different bands of frequencies. Its function is to modify the dielectric of the skin and to allow the radio frequency from the Holt radio transmitter to pass into the body. This is the radio transmitter used for the Holt radio wave therapy. Dr. Holt researched over 30 years and found that 434 megahertz was an effective ultra-high frequency radio wave to use in the treatment of cancer. We have used this for Nicole and piggybacked it across the frequencies from the BioLife electrotherapy machine. The electrodes used for Nicole's treatment are manufactured by Valley Lab, and they're actually a patient return electrode designed for electrotherapy or electrocautery. The contact terminal coming from the Holt radio wave therapy and the BioLife machine can be seen here. We use a Hirschman attachment to the electrode because we need to spread the electrical signal between the two sides of the pad, and you will see that the red lead is the one coming from the BioLife machine and the black lead is coming from the Holt radio wave therapy machine. Nicole had neuromuscular dysfunction in her left hand and her left foot. The electrode placements were initially on the lateral surface of each shoulder, and she had an immediate response to the first 30 minutes of treatment with the electrodes in that position. We then left the electrode on the left shoulder and applied the other electrode to the left hand for a further 30 minutes. And then we took the electrode on the left hand and placed it on the left foot for a further 30 minutes. And this is with both the Holt radio wave therapy and the BioLife machine running together. Nicole received ozone therapy through these special headphones. You can see a tube which joins the two headphone cups together, and the ozone is brought in through a pipe to one of the headsets, and suction is applied to the other headset so that excess ozone is removed so that the patient doesn't inhale excess ozone. We use a steam sauna which is manufactured by Smile. The steam heats the patient sitting in the sauna to 42 degrees, which is the hypothermia temperature that is used for the cancer patients, and ozone is infused into the sauna so that the patient absorbs ozone throughout the skin of the body. But because the head of the patient is outside the sauna, they do not inhale excess ozone. Nicole received electrotherapy from the Swiss F-scan machine that measures the resonant frequencies of abnormal cells within the body, and then during the treatment modality inverts those resonant frequencies. This part of the screen shows that the range of frequencies scanned goes from 80,000 hertz through to 560,000 hertz in 1,000 hertz steps. During treatment, Nicole was exposed to special fluorescent tubes to increase her vitamin D levels. Nicole was given the following supplements. The detox drops were used instead of DMSA because she has heavy metals, which I'll show you in a minute on the hair analysis. We use the detox drops instead of DMSA because she has a sensitivity to sulfur. The vitamin C was prescribed 4 grams a day to be put into her filtered water bottle to be taken throughout the day. The hypericum, or St. John's wort, was prescribed because Nicole was having trouble with sleep. The tyrosine, phenylalanine, ornithine and arginine were prescribed as part of Professor Leshin's neuroimmunology, and I'll show you his book shortly. The basis of his treatment is that if the helper cells in the immune system are out of balance, Th1 and Th2, then they can be brought back into balance with these 4 amino acids. This is the detox drops from Full Health Industries, an Australian manufacturer, for removing heavy metals when DMSA is not acceptable to the patient because of sulfur sensitivity. This is part of Nicole's hair analysis from MicroTrace in Germany, and you can see high levels of calcium and magnesium, which in hair analysis indicates a deficiency. So we would supplement her with calcium and magnesium. Her copper levels are high, and the Full Health product, the multi-metal detox, should reduce that. Further down in the report, we can see aluminium, barium and bismuth are high, and these will also be treated by the multi-metal detox. On the second page, we can see that lead, mercury, nickel and tin are all high, and these will also be treated by the multi-metal detox. We will plan to do a urine test monthly and repeat the hair analysis after 3 months to make sure that the detox techniques are working.